Welcome to Perspectives. I'm Bob Lubzelder, and our guest today is Nichelle Blood. She is the Conneaut City Health Commissioner. And Nichelle, first, give us a little bit of background on yourself.
Well, I started here at the Conneaut City Health Department in 2016 as a sanitarian in training, and I winded up getting my registered sanitarian license. So I was doing the inspections for the food service, marinas, campgrounds, tattoo parlors, and then I became the environmental health director. And then after that, our previous health commissioner, Sally Kennedy, retired, and I wound up taking her position after she retired in March of 2018.
So how have things changed with COVID?
Things have changed dramatically, honestly. We have been working, our director of nursing, Louise Cleveland, has worked with a lot of our patients that have tested positive for COVID and done a lot of the contact tracing that those individuals have come in contact with. We don't have any more in-person meetings like we used to before this, and we do a lot of conference calls or Zoom meetings or WebExes online. Mm-hmm. So that definitely has changed a lot since the beginning of this year.
How do Conneaut numbers look right now as far as COVID?
So right now we have a cumulative positive of 132 individuals. Right now we are actively monitoring one individual. Out of all of those individuals, we have had 20 hospitalizations. At this moment, we don't have any. 126 individuals have resolved their symptoms, and we have unfortunately had 5 deaths.
What percentage of this is the prison as far as COVID people?
I don't have that direct percentage, but I would say probably about close to 90 of those individuals are from our congregate living facilities.
Now, it's interesting because from what I know, the prison in Albion hasn't had any cases.
No.
I don't, at least last I heard. So I don't know, that's interesting.
That's wonderful. They've been able to keep it out of their facility.
On something else, go ahead.
I wasn't aware of that. That's great to hear that they have been able to do that.
Tell me about restaurants. When you inspect them, what are you looking for now? Maybe that you didn't look at before.
I actually don't do our restaurant inspections anymore. Our environmental health director, Laura Studevant, is the one that does do our inspections, and when she is going out to them, she is just making sure that they are following the guidelines and the orders that have been put in place for them to remain open and operating.
So give me some examples of guidelines, like every other table people sit, or some of them have those like plastic shower curtains between tables.
Yeah, so the guidelines that the state put out is that if you can space out your 6-foot distancing, if you cannot, then you need to put some type of barrier in between individuals so that they're not in contact with each other. So that's why shower curtains or plexiglass has been put in place, because they cannot maintain that 6 feet of social distancing. The other thing is making sure that employees are wearing masks when appropriate, making sure that things are being cleaned at least every 2 hours, high-touch surface areas, making sure everything with high-touch surface areas are at least wiped down or cleaned every 2 hours. Trying to think what else there is. Even just doing that and then doing the regular inspection on top of it, there is a lot of things that need to be looked at.
I would imagine. How are restaurants and bars in Conneaut doing?
Restaurants and bars are doing wonderful in Conneaut.
Because I know that there's one in Austinburg that got cited, and Geneva on the Lake, one of them got cited 2 days in a row, like a Friday night and a Saturday night. Mm-hmm. So...
Yeah, our bars and restaurants and stores are doing well. We still receive complaints every once in a while, and we follow up with them, but we haven't had to take any further actions with that.
Have you gotten calls saying that this restaurant, they're not wearing masks or whatever, and you go there and find out that the callers are indeed correct, or is it usually not?
There is a lot that is not valid. There are a lot of complaints that are not valid.
So more majority of them.
Yeah, more of the majority of them are not valid complaints. Or it could have been maybe the individual would have like a break and they were sitting outside maybe smoking a cigarette or just sitting outside enjoying the fresh air and they didn't have a mask on. It's sometimes that's what individuals see and that's when we get a call. Sometimes it is a valid complaint and then we have to do education and inform them that this is the rules, this is what needs to happen.
So like a bar can have its liquor license taken away, correct?
That is correct, yep.
And what is it? They can't serve alcohol after 10 o'clock or something?
Yeah, so last call for the bars is 10 o'clock, and then the doors and everyone needs to be out by 11.
So do you know why 10 o'clock was given?
I do not. That was something that was put out by the governor and the Liquor Control Board.
Because I think there's a similar law in Pennsylvania as well.
Yeah, I believe so. And I know that Kentucky, they're kind of similar too, except their last call, I believe, is at 11.
Huh.
So I am not sure why 10 o'clock was chosen.
When this all started, restaurants closed, and then they were allowed to have takeout. And like we took advantage of that, but everything wasn't, sometimes the food was a little cold or something was left out or something. And then spring and summer comes along and you can sit out on the terrace or whatever. And if you go there around 9 o'clock at night, or 8:30 or so, it's like 80 degrees and nice and warm and you can have a nice meal. These days, you go out at 8 o'clock at night, it's pitch black and 50 degrees.
Yeah.
So I guess my question is it safe to go back into restaurants?
Well, I know that our restaurants are looking at alternative ways to be able to bring their customers back inside. We've had a couple phone calls with people asking about putting up extra barriers so that they can have more customers inside. So I know that we are working on it. Obviously, we're hitting the winter months now, so
yeah.
But I mean, when you are outside and air's moving and everything else, your chances are lower, and then when you go inside, your chances obviously are going to be a little bit higher because everyone is a little bit closer. But they are taking all the necessary precautions to protect our community.
So have you gone out to some restaurants inside?
I'm sorry?
Have you eaten at some restaurants inside?
No, nope. That's just I have not eaten out since the beginning of all this, but that's just because I don't want to put myself in a position. Right. Yeah.
And I think that's a lot of people. Have we lost any restaurants because of this?
Off the top of my head, I don't believe so. I think all of our restaurants have remained open.
Which is good. I mean, there's all kinds of businesses that have suffered from this.
Yes, yep.
When you first heard about this COVID-19, did you expect this to be happening? And it's almost October and it's still a major part of our lives and it looks like it's going to be for months to come. Did you anticipate this?
I mean, kinda, because the state kept telling us that we were going to hit our plateau in June or July, and then it would still be there in the winter months. So, I mean, we knew that it was going to be a long haul. We were in this for the long haul. But our numbers are decreasing, and we need to keep making sure that they are decreasing. We don't want to see an influx.
Definitely. What about when the cold weather hits? We hear these stories that there's going to be a big upsurge.
Mm-hmm. Yep.
Do you think so?
I mean, we'll have to wait and see what exactly is going to happen. We still need to be washing our hands, wear our mask. We need to social distance. Do the best that we can do to prevent the spread of COVID.
We still hear people, some in authority, talking about that masks are ineffective and they really aren't necessary, and they aren't the most comfortable things in the world. But what is your assessment of masks?
Well, for me, it's the mask is showing that you're being respectful for other individuals. It's protecting the person that you are coming into contact with. Now, obviously, there are exemptions to the rules for people that don't wear the mask because maybe they have a medical condition to where they can't wear it. But it does offer some protection from contracting COVID.
Mm-hmm. Okay, Nichelle Blood is our guest. She's the Conneaut Health Commissioner. You also were involved in, and I believe University Hospitals Conneaut was involved in inspections of schools. Tell me about what kind of things that you looked for there.
So when we did the school inspections, we looked at the spacing between the desks, how the flow of the students would walk through the hallways, looked at where areas were that couldn't meet the 6-foot distance and asked them to put up some type of barrier. And then, I mean, we were big. I mean, the schools. We're still working with the schools every day, just because we need to keep that constant communication and protect the kids and the staff members that are in our schools.
Mm-hmm. So there haven't been any. Now I understand at Pymatuming that there was one child that tested positive for COVID. Mm-hmm. So there hasn't been anything like that here.
No, we are okay for now.
It's interesting.
We haven't had any cases.
And Conneaut's lucky that it has newer schools with air conditioning because students in Buckeye have not been able to go back to school yet.
Yes, that is correct.
It's because they need the air conditioning to be comfortable in their masks, but they can't have fans, correct? They just kind of, it's like the things that you use to dry your hands, the hot air things. They just blow the germs all over.
Yep. And they did not want that to happen, so that's why they have not gone back to school yet.
Tell me a little bit about, we don't have too much time left. Tell me who's on your staff. How many people are in the Conneaut Health Department?
There are 4 of us. So there's myself, Louise Cleveland, who is our Director of Nursing, Wendy Julia, who is our Registrar Office Manager, and Laura Studevant, who is the Environmental Health Director.
If I remember correctly, everybody kind of pitched in at first when inspections needed to be done, and there's a lot to do with few people to do it.
Mm-hmm. Yep, we all pitched in a little bit to help each other out. I still have my registered sanitarian license, so I was able to help Laura with inspections and get our restaurants back open when they were allowed to. And Louise and Wendy have been working with patients with COVID and contact tracing. So, I mean, we've all chipped in and helped each other in some way.
We got a minute left. How do you work? There's 2 other health agencies in the county, I believe, Ashtabula County and Ashtabula City. Are you in daily contact with them or regular contact?
Oh yeah. We usually talk to one of their staff members at least once a day. So we are in constant communication. We want to work together as a county. So.
Last question. What advice generally do you have for people today that don't want to get COVID? What should they be doing?
Social distancing is the best thing. Stay away from people as much as possible. Wash your hands and wear your mask.
If people are outside, is there less importance, less emphasis on wearing a mask if you're out in the open?
If you can maintain the 6-foot social distancing, you do not have to wear a mask.
Okay. 10 seconds, 15 seconds left. How about exercise? I hear, people that are healthy do better. So do you encourage people to get out and walk and not be in the house?
I mean, it's always good to be out walking around, but I don't know any of the studies on that exactly with the protection of COVID and exercise. Okay. I'm not sure on that one. I do apologize.
Okay. All right. Well, thank you very much for your time, Nichelle Blood, Conneaut Health Commissioner. Thank you. This has been Perspectives on 1360 WOW. I'm Bob Lebzelder.